Hello, this is a preview on pediatric urology. Urinary tract infection. I will start this section with some important definitions. First one is sterile pyuria. Simply means presence of white blood cells with negative urine culture. More than or equal 3 white blood cells in urine or positive leukocyte esterase on dipstick and negative urine culture. Asymptomatic bacteriuria, simply positive urine culture with no symptoms. Uncomplicated UTI means a positive urine culture with symptoms. For example, frequency, urgency, dysuria, and or new urinary incontinence. Complicated UTI means a positive urine culture with urologic abnormalities. For example, hydroureter, hydronephrosis, or vesico-urethral reflux. Pyelonephritis, simply positive urine culture plus fever. Causes of urinary tract infection. The most common cause is E. coli. This is the most common cause. Other bacteria, Pseudomonas, which is a non-enteric gram-negative, or Enterococcus faecalis, or Klebsiella, or group B Streptococcus, and this is more common in neonates. Clinical presentation of posterior urethral valve. This should be considered if there is an ability to empty the bladder, or very common, very important sign, weak urine stream. So if you have a boy with weak urine stream, consider posterior urethral valve. If unrecognized during the neonatal period, this may present later with failure to thrive, uremia, sepsis, and even renal failure. If less severe, may present with UTI or urinary incontinence at later age. This is a VCUG for a child with posterior urethral valve. You see here the trabecular muscular hypertrophy on the VCUG, and also the bladder is dilated, and you can see the posterior valve is dilated and elongated, and this is the band. This is the posterior urethral valve obstruction at this point. So this is a classic case of posterior urethral valve obstruction. And the treatment is transurethral ablation. Treatment is surgical transurethral ablation of the valve leaflets by endoscopy. Testicular torsion. Testicular torsion is a surgical emergency. Testicular or spermatocord torsion is an emergency and most commonly in boys between age 12 and 18 years. Clinical presentation of testicular torsion, acute onset of pain, very painful, can be associated with nausea and vomiting, can present with abdominal pain. So it's very important for any child with acute abdominal pain to examine the testicles or genitalia, especially in boys. Scrotal edema and redness, loss of cremasteric reflex, high-lying horizontal transverse position testis. Diagnosis of testicular torsion is a clinical diagnosis. On ultrasound order, color, flow Doppler ultrasound will show decreased blood flow on the affected side. Management of testicular torsion, immediate urology consult in suspected cases, and is important to speak to the urologist in person. Don't leave a message. Then very important to obtain immediate scrotal ultrasound. So this consultation can be done even before the ultrasound if suspected clinically. Immediate surgical exploration and fixation as soon as possible before 4 hours. Manual detorsion, which is holding the testicles and you opening like you are opening a book. This may be attempt after obtaining a testicular ultrasound. Prognosis tests can be lost if the surgery was delayed as little as 4 hours. By 24 hours, infarction is almost universal.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the last-minute review series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams.